So a very good morning to our beloved lecturer, Madam Nurul Amira, and also to my beloved friends. By the way, my name is Ilakin Morris, and I'm currently studying at uh, DPH Cohort 18 in KPGIC Penang. So today, the topic that I would like to share today is regarding about my individual assignment, and it's about the occupational health and safety presentation. So what is the disease and also the or the injury of the victims? So the illegal dumping of chemicals or toxic waste into Sungai Kim Kim in Pasir Gudang, Johor has sickened about 6,000 victims in total and also forced the closure of all 111 schools in the area. So what are the types of cause for this? What is the type for this occupational hazard? It will be chemical hazard. And how are the victims were diagnosed with the conditions? So the incident that was started on 7th of March 2019 after several students and canteen workers from two schools which are near the river were fall sick and complaining of breathing difficulties after inhaling the chemicals that were dumped. So both schools were ordered to shut down and all the victims were sent to the Sultan Ismail Hospital while investigations were being carried out by the state authority over the cause. So as a continuation, the 21 people that were warded with at the hospital were being admitted to the emergency unit and also the intensive care unit, which is the ICU. And some of the students that were brought to the hospital were already fainted and developed with symptoms such as vomiting due to the exposure of the chemicals. So on the 11th of March, after several days later, the second wave of air poisoning took effect with further about 106 to 207 victims, which were hospitalized before escalating into more than about 1,000 victims with 8 admitted into the ICU. So the spread of the toxic fumes, they were aided by hot weather which combined like strong winds and also which made like more people sick. So this incident it occurs from the 7th of March until the 11th of March 2019, and the chemicals that were being dumped would be methane, benzene, acrylonitrile, hydrogen cyanide, and also acrolein. So for first, methane, it can reduces the oxygen levels in the body and can cause organ damage, including to the brain and heart. So benzene, it also can cause cell dysfunction, and acrylonitrile, it is also classified as a class 2B carcinogen or possibly carcinogenic. Besides that, hydrogen cyanide, which impedes the normal use of oxygen by the body's organs, and it can be deadly. And for acrolein, its exposure, it can cause like strong irritation to the skin, eyes, and also the nasal passages. So what is the cause of the said condition for these victims? So the chemical that were disposed, which happens on the 6th of March, whereby P Tech Resources in Ria Berhad releases like scheduled waste. So the Johor Department of the Environment, they detained about 2 factory owners and also a worker, all in the 50s, on the 11th of March over their suspected involvement in the dumping of the chemicals. So it is said it is an illegal factory owner which is due to charge at a magistrate court in Johor. So they were all charged under section 34B 1A of the Environmental Quality Act 1974, which carries a maximum of 5 years and also a fine which is not more than 5,000 ringgit upon conviction. So as a conclusion, the Johor Sultan Ibrahim Ismail has urged an immediate action against the perpetrators involved in this pollution that endangered the public's lives, while expressing his appreciation for the medical team which has been working tirelessly to treat the victims in the hospital. So the Sultan has pledged over a total of 1 million ringgit towards the helping rescue agencies and also authorities to gather the necessary means and also the equipment to resolve the matter. Meanwhile, expressing his views that the incident of that shows the need of the government hospital to be built in Pasir Gudang. So for the continuation, ex-Prime Minister Tun Dr. Mahathir Mohamad and ex-Deputy Prime Minister Wan Azizah Wan Ismail has visited the victims of the pollution at the hospital in Johor Bahru on the 14th of March, and it said that the situation was under control, where the residents were not necessary to be evacuated from the area, and also that there is a need to review the country's Environmental Quality Act in 1974 in light of the serious pollution. The federal government has approved an allocation of 8 million for river purification works and has ordered various agencies including police, military and hazmat teams to support the situation of the affected area. So as a continuation, as like what I said just now, the offenders were charged under section 34B1A of Environmental Quality Act in 1974, which carries a maximum of 5 years jail and also a fine which is not more than 5,000 upon conviction. So thankfully, a total of 6,000 victims who were affected by the pollution are reported to be safe. So what are the awareness that can be given based on the hazard? So they have to impose stricter rules, especially for companies who manage the factories that were dealing this sort of chemicals. So by giving this awareness, this will ensure that they will not simply dump chemicals into the rivers that could cause harm to the public's health. So the awareness also can be done by giving talks to the public about how harmful chemicals are, especially to victims who were once affected before. So they could share about their experience to the public to ensure that they would be able to spot like early signs of hazards, especially when spotting spillage of chemicals, and thus give further action before it is all too late. So they also can share blogs, like for example the state governments or the health state governments, they can give out like precautions when spotting like hazards of chemical spillage through the social media. So for example, wearing masks or doing any safety precaution to ensure that the person is safe. And it can be shared through Facebook, Twitter, Instagram and more. So these are my reference, and that is all from me. Thank you.